Okay, thank you so very much, everyone, for joining us. This is Psoriasis Awareness Week, and this year's Psoriasis Awareness Week theme focuses on lifestyle factors that may be important to consider when living with psoriasis or psoriatic arthritis, including diet. This topic is regularly talked about, asked about via our helpline and within our communities. Not only that, but understanding more about the role of lifestyle factors in treating psoriasis was identified as the #1 psoriasis research priority by the 2018 Psoriasis Priority Setting Partnership, or Psoriasis PSP, which perhaps many of you submitted questions to yourselves. And so we wanted to bring you up to speed actually on what we do know so far. So I'm absolutely delighted to be joined today by Dr. Thiviyani Maruthappu, who's a consultant dermatologist and nutritional professor of health psychology and behavioural medicine at Cardiff University. So you're both very welcome to the session. And I suppose the biggest question that we're here to answer is there evidence for nutrition in psoriasis? Is it important? Vivi, if you would like to.
Yes, thanks, Helen, for the invitation as well to join today. So when it comes to evidence for the role of diet in psoriasis, that's something that I'm really interested in, because for so long I've had patients coming to the psoriasis clinic saying, look, I've tried this diet, I've tried that diet. Should I try, cutting out gluten? Should I go vegan? Is that going to help my psoriasis? And the problem is when we look at the data, sometimes we can see that there have been studies done, but the studies maybe weren't carried out in the most robust way that we would be able to recommend those as helpful diets for people with psoriasis. But in terms of what we do know, there are a few things that we do know that have come up in the evidence time and time again when we've examine patients who have psoriasis and diet and lifestyle factors. And a healthy diet is important in psoriasis, and that's what the evidence shows. And these are studies that have been carried out in mice in the beginning, large studies of patients as well, and trials of patients as well. And they looked at all of these studies together, all of these studies in humans, and they call that a meta-analysis, when we look at all the different types of evidence and we compare them to each other and we try to make a conclusion. And a meta-analysis that was performed quite recently looking at lifestyle and psoriasis does support having a healthy diet and a healthy lifestyle when it comes to treating psoriasis. So that is definitely an important factor. But when it comes to what diet should somebody follow, there is a bit less evidence for that. But the majority of studies that have looked at it, it looks that eating a Mediterranean type of diet, so that is lots of fresh vegetables and whole grains and olive oil, some fish if you're happy to eat it, not too much red meat, not too much refined sugars, that appears to be the healthiest type of diet for somebody who is living with psoriasis or psoriatic arthritis.
Thank you, Chris. Would you like to add to that about how is nutrition important for people with psoriasis?
Yeah, I'd love to. Thank you. I reinforce everything that Tivi's already said, that different kinds of diets or what we eat suit people differently. There isn't one single type of diet that suits everybody. But what we do know is to, in general, eat that Mediterranean type diet probably suits more people. But certainly, I would not be in the business of advocating a particular diet, especially if it tends to be a little bit unusual, quirky. There's very little evidence in some of those quirky diets that cut out whole food groups, for example, work. But the other thing I wanted to say was that what you eat, and certainly healthy eating, forms part of what we're talking about as a healthy lifestyle, which includes things like not drinking alcohol excessively, stopping smoking if you're a smoker, we use diet in the broadest sense of the word for a couple of reasons. One is some people use it for weight loss and others use it to live a healthier life. And I guess that I'm always helping and trying to encourage people to live a healthier life now so that you have a healthier future. And it's not easy. We know it's not easy, particularly if you need to lose weight and you're using particular diets in order to lose weight. But we do know that lifestyle factors that we talk about, healthy diet being one of them, can improve other factors. So for example, if you're cutting down weight, because weight is a problem and you're eating a healthy diet, you may find that your sleep improves. You may find that you become more active. You may find that you don't want to drink as much alcohol as you did before, because of course we know that the amount of calorific value in alcohol is hidden and it's excessive. So yeah, my take on it is a healthy lifestyle is a cluster of particular actions, behaviors, and healthy diet is part of that. And you know, adopt the healthiest diet you possibly can now, because it will help to motivate you to change maybe some of the other aspects of your diet or your lifestyle.
Okay, thank you very much. So you've both touched on the Mediterranean diet as a diet that could help people with psoriasis. And I wonder, Thivi, maybe if you could explain what constitutes a Mediterranean diet, you know, what is it?
Yeah, so if we look at the studies that were performed, so what I wouldn't say is that a Mediterranean diet would cure psoriasis, but what it can do is that it can help with the other things that can be associated with psoriasis. So we know that psoriasis is linked to an increased risk of heart disease in particular. And that's why in our clinic, as Chris mentioned, we are very vigilant about lifestyle as a whole, exercise and stopping smoking in particular, because those can also increase our risk of heart disease. And when I'm talking about heart disease, I'm mainly talking about heart attacks. But there's also an increase of diabetes as well. And so a Mediterranean diet is actually really helpful for that type of risk factors. And it's been shown in many studies to be really helpful for your risk of heart attack as well. And what we're talking about, it doesn't have to be what you would eat on holiday, you know, sitting in Greece or somewhere like that. It just means focusing on whole grains, so that could be oats, it could be rice, it could be pasta, ideally brown pasta. And it's also having lots of legumes, so lentils and pulses, such as chickpeas. Those are sources of B vitamins, fiber and whole grains. Together, they're really good for our gut bacteria, and we can talk a little bit more about that later as well. And it's also having lean proteins, so that can be a bit of chicken, a bit of fish. If you're vegetarian, it might be tofu, it could be egg. And also making sure you have plenty of healthy fats. So a Mediterranean diet is all about things that you're bringing into your diet. It's not about cutting. It's about being as inclusive with all those fresh fruits and vegetables and whole grains as we can be. And there is always space for the things that we all like as treats, sweet things, or a glass of alcohol now and again. There's room for all of that. It's not that you have to cut everything out. It's about really just focusing on bringing things in. And having healthy fats in your diet, we know, is really important. And those good fats can be from nuts, they can be from seeds, and they can be from healthy oils as well, olive oil being the most obvious one.
Okay, super. Chris, would you like to come in there with regards to the Mediterranean diet? And I know that you mentioned not necessarily taking out food groups, but certainly one of the questions that we're asked often is, should I become vegan, you know, or go gluten-free? Obviously two very different diet choices.
Yeah. You know, any extreme of diet, whether that's a keto-based diet, you know, meat, very heavy meat-based, or a vegan type diet, has to be considered very carefully because people are very different. No one diet suits everybody. So if you're considering doing something really drastic, you really need to take advice, speak to people who know what they're talking about. But as Tivy's mentioned, that Mediterranean diet, based diet, there's some good evidence that that can actually help to lower inflammation. It doesn't cure inflammation, but it can help to reduce inflammation. And this, you know, that's something, of course, that's really important to the people on this call, that background inflammation is higher anyway. So anything that you can do in terms of your lifestyle, and that includes not smoking if you're a smoker, reducing alcohol if you're an alcohol user, but also diet. There are some foods that are good in helping reduce inflammation. So again, you know, read up on it, speak to people who know what they're talking about. Don't react to something that you've seen online or something that drops through the post that gives you some very different, quirky take on things. Speak to nutritional experts, speak to your doctors, but yeah, consider diets that might help to reduce inflammation, because there is some good evidence coming through now that the foods we eat are involved in that inflammatory process. But Tivy is more expert than I am on this, so you know, I will rely on her steer on this particularly.
So moving, you know, along with that, you've both spoken about perhaps avoiding the elimination diets, but more going towards supplementing your diet with the good things, you know, that could help. Would additional supplements, vitamins, you know, that sort of thing help at all?
I get asked a lot about supplements from patients, and I've had a good look at the evidence for supplements. And at the moment, the only time to supplement is to supplement your vitamin D if your levels are low. And we should all be supplementing in the winter months 400 international units a day. So that's between September and March. Everybody, whether you have psoriasis or not, should be supplementing. And they have done several studies to see if giving extra vitamin D helps patients with psoriasis, because we use vitamin D in creams for psoriasis. So you'd think that taking an extra bit as by mouth might help to clear your skin. But none of those studies have shown that if you have normal levels of vitamin D, so if your levels are in the healthy range, that there is any reason to supplement. So in the psoriasis clinic, we do check vitamin D levels and we do treat it if it's low. But if your levels are normal, then there is no need to additionally supplement beyond the government guidelines of winter month supplementation. The only caveat to that is if I have a patient who chooses to be vegan, and they may choose to be vegan because they, you know, for ethical reasons or for lifestyle reasons, then they must have a B12 supplement, because it's very difficult to get enough B12, vitamin B12, through your diet alone as a vegan. And I also recommend supplementing their omega-3. If they're vegan, there are algae sources for omega-3, because they're not eating oily fish. And I also say to patients, if you're not eating oily fish twice a week, so it could be herring, it could be salmon, it could be mackerel. If you're not having that twice a week, then it is worth taking an omega supplement as well. And the dose for that is 400 micrograms of DHA. So those are the only situations where I recommend supplements. There have been studies that have been looking at zinc, selenium, and they haven't seen any benefits to those supplements.
Can I come in and mention about studies? Because I see Leanne in the chat is asking, do we have good studies? And the short answer is no, we don't have good studies, well controlled in the way that we would with new pharmacological interventions, new drug trials, for example. We don't have that level of research to support which specific dietary component affects which aspect of psoriasis functioning. We have got some studies, they're starting to come through, but by and large, we are missing the really good quality studies, Leanne. So, you know, if there is any opportunity to either discuss with your GP, your dermatologist, your rheumatologist, if you're seeing a rheumatologist, you know, ask them what studies they're using to advise the lifestyle advice that they're giving you. And if there's any opportunity to put some pressure on to fund big studies, then, you know, please do. You as patient partners have a lot of power to shape the agenda, the research agenda. And when you have, please use it, because, you know, we know that there are very poor studies out there, really.
Thank you. And obviously, psoriasis can affect all points of the lifespan. Is there any specific part? So for young people, should, you know, would they need to supplement, for example, more, you know, in a certain scenario than people in middle age or people who are older? Are there various points that people may need to readdress any supplements that they may need to have?
Not as far as I'm aware, Helen. I haven't seen any studies looking at that, but exactly as Chris says, that there is a very poor evidence base for the nutrition research. Most of the large studies have come out of Italy. They've done quite a few studies, not surprisingly, on the Mediterranean diet. And the National Psoriasis Foundation in the States also reviewed all the literature. Their academic body reviewed all the literature and put guidelines forward on diet and psoriasis on the basis of those studies. But overall, exactly as Chris says, there really isn't enough information available. And I just saw one of the other questions that Lou asks, is there any evidence to suggest that nightshade foods affect psoriasis? And nightshades are this group of foods which are aubergines, tomatoes, peppers, potatoes. And there's been quite a bit of talk about whether these foods are pro-inflammatory and should they be cut out of the diet if you have psoriasis. I don't advise my patients to do that. And if you look in the literature, there isn't any evidence to support it. The larger study that looked at it was a survey of people who had psoriasis, and they were asked, which diet have you tried and which one did you find helpful? And some patients who tried cutting out nightshades found it helpful, a minority, but the vast majority didn't find it helpful. So at the moment, we don't really recommend doing that. And there are lots of antioxidants and healthful properties in those foods, particularly in the peppers and the aubergines and those dark coloured vegetables. They have a lot more to give, I think, than to take away.
Okay. We're getting some lovely questions coming through, so we will turn to those questions shortly. But practical tips. So what changes could people with psoriasis or psoriatic arthritis start today? And I suppose more, so what could people start today? And then obviously with Chris, and how do people take any positive change as well?
Okay, so probably the single most important thing that people can do if they're smoking is to stop smoking, undoubtedly. If you're heavy, try and reduce weight. We appreciate it's really difficult to stay lean. And I don't mean stay slim, skinny, I mean stay lean, because you have to protect your muscle mass. That's really important. So don't be chasing numbers in terms of trying to reduce weight. Try and change the ratio of fat to lean muscle. That's really important. But it's not easy. So one of the things that I always encourage people to do is to work with somebody else, whether it's another family member, whether it's a friend. If joining clubs is something you like doing, then consider that. But tell people that you're planning to do it, if it's to give up smoking or reduce your alcohol or whatever it is, if it's to reduce weight, and make a plan. So you might have a goal that says, you know, Christmas is 6 weeks away. I want to be able to say by Christmas, I have X, Y, and Z, stop smoking, reduce smoking, or alcohol or whatever. So make a plan that works for you. So don't simply have a goal, but work out the plan to get to that goal and break it down week by week or even day by day. Today I will. And try and make it positive. So if you're losing weight, for example, not by the end of this week, well, I will have lost 2 pounds or whatever it is your goal is. But on Monday, I will go for an extra walk, possibly, or, you know, whatever it is. But do it day by day. We know that committing to achieving a goal and making a plan that works for that goal, saying it out loud, telling somebody about it, it increases the likelihood of you achieving that goal. So tell people you're going to do it, spell it out, how exactly you're going to do it, break it down, keep it manageable. Don't set yourself up to fail. Don't set up a goal that is difficult for anybody to achieve, particularly in the dark months. It's very difficult for us to do things. So make it work positively for you and not trip you up on the way. But certainly talking to other people and committing to it, telling people what you're planning to do, does increase what we talk about as our intentions to implement the plan.
That's a really good tip there. Thank you. And Thivi, so what changes, you know, could people start maybe today?
Yeah, so one tip that I give my patients quite often is to look at the Eat Well plate, which is on the Department of Health website. It's on the NICE website. It's called Eat Well. And it's a picture of a plate, and it's kind of what your plate should look like. And I say print it out and keep it in your kitchen so that you can just use it as a useful, rough reference into what your plate should be made up of. And what it really does encourage people to do is just eat more vegetables and fruit, so they have a bit more of a balanced diet. And make sure with every meal that you have a good fat in there. Think about what your good fat could be. Could that be sprinkling some seeds, or could it be having some nuts, or throwing that into something that you're making, or pouring a little bit of olive oil on there, but including some healthy fats, and just having a look at that plate just to get an idea of what a balanced plate is, what we would like to have in a balanced plate of food.
Super. Now I can see some lovely questions are coming through. Do please keep them coming. But both Thivi and Chris are fantastic researchers in psoriasis, and so Thivi, would you like to explain about your current research and the Apple study, and then Chris, if you would like to explain about any of your research areas to people, and if and how they can get involved.
Thanks, Helen. Yes, so we were very lucky this year to receive funding by you from the Psoriasis Association for the Apple study, asking people with psoriasis about lifestyle and eating. And that's with myself and Professor Chris Griffiths, who many of you may be familiar with. And it's with the nutrition scientists at the Department of Nutritional Science at King's College London, which is one of the largest research centres for nutrition research. And we're going to be performing initially a survey of people who live with psoriasis and asking them about different aspects of their diet, and comparing that to people who don't have psoriasis, and see if we can pick up on any clues and any advice that we could give on the basis of that study. And then after that, we'll be doing a little trial to introduce a dietary intervention. So putting 2 groups of patients with psoriasis on different diets and seeing if that helps their skin. And we will be reaching out to members later on when we've got the study up and running, to see if you'd like to help us, particularly with the survey part. And we're hoping that by working with nutrition science researchers who carry out trials all the time using diets, that we can get some more useful information, and hopefully that this will help us towards making guidelines later on.
Yeah, and I see, yes, I also want to say thank you to the Psoriasis Association membership, and your fundraising funds an awful lot of our research, and I've been a beneficiary of the really hard work that Psoriasis Association members and staff do in terms of fundraising, so thank you so much. I see that there's a couple of questions around gut health, around probiotic use and leaky gut and so on. I mean, the short answer is we don't have a really strong evidence base for that in humans. We do have some evidence base, largely it comes from animal studies, and there are a small number of observation-based studies rather than trials and comparisons in humans, but it's a bit early for us to be saying absolutely, you know, this is the best form of diet for this kind of healthy gut and so on. But probiotics are showing to be quite useful actually, but it's very early days. So Helen's invited me to talk a bit about our work, and of which she's been part of, which is wonderful. And of course, Tivi and people in Manchester have been part of this research for many years. And we're more focused on motivation. What helps people once they have expressed a wish to change something? What are the best methods to help them stick with that plan? And not just patients who might want to lose weight, who might want to cut down their alcohol or stop smoking, but how do we train clinicians to support patients to do that? So the program of research that I've been involved with for the last 7 or 8 years has been about training clinicians to help provide that motivational support for people living with inflammatory skin and joint disease to stay focused on their goals, because we know it's not easy. I don't think any serious clinician or researcher working in this field would pretend that this is easy. If it was easy, we'd all be living healthiest lives. None of us would be struggling to not have that second glass of wine, or to cut down, you know, our weight and stay lean, or, you know, do the exercise. You know, we appreciate it's not easy, but there are hints and tips that certainly people working with you can help you stay motivated, and there are things you can do for yourself to stay motivated. So I would strongly suggest that you have a look at some of the research that we've written up around supporting motivation. We call it motivational interviewing. That's what the clinician will do with you, but essentially it's a form of consultation that you have with your doctor or your specialist nurse, who will help you to set these goals and help you to stick to your plan. So that's the kind of research that I, as a psychologist, I'm working on in this field at the moment.
Thank you, and congratulations both of you on receiving Psoriasis Association grants, because we don't just give them out willy-nilly. So looking at the questions, and I feel a little bit of the despair that Lou is asking. She's slim, doesn't drink or smoke, exercises, seems to be doing everything right, eats a healthy range of foods. Is there anything else that she can do, because her psoriasis is still severe?
So I think to Lou, it's really important to remember that food isn't the cause of psoriasis. Psoriasis is multifactorial. Genetics, we know, is really important. It doesn't mean that one of your parents had to have had psoriasis, but we know that genetics is really important, and that these lifestyle factors overlay. So the fact that you don't drink or smoke, and that you exercise, and that you have a good diet, you're doing so much for your health in the long term. And it really is an investment, as Chris said earlier, in your long-term health. So you're doing all the right things, and your psoriasis is still severe because obviously genetics plays such an important role in psoriasis. So in terms of your lifestyle, I haven't really got anything to add in there. We did talk a little bit about the gut bacteria a few minutes ago. And as Chris said, the evidence to support taking a probiotic is not there yet. But there are ways that we can look after our gut bacteria, because there have been quite a few studies where they have looked at the gut bacteria in people with psoriasis, and there may be a little imbalance there. We're not quite sure if this is a cause or is it an effect, but there is very little harm in eating food that supports our gut bacteria, and it may have beneficial effects to our overall general health and well-being. So when I'm talking about foods that support our gut bacteria, what are they? So they can be fermented foods like kefir or kimchi. Those are two examples of some fermented foods, but lots of fruit and vegetables which contain the prebiotics that the good bacteria feed on will support the growth of the good bacteria in the gut. So if you're not already doing that, then I would recommend just supporting your gut bacteria, because we don't know enough yet to say this is the right probiotic for patients with psoriasis. This is going to result in a benefit from your skin. In eczema, we're a little bit further along in the research than psoriasis. I'm sure the day will come where we'll be able to give some better advice, more specific probiotic advice. But until that time comes, I recommend patients just to support their gut bacteria as well as they can.
Yeah. Yeah, and I see, Helen, that Lynn is asking a question about the role of stress, so it might be relevant to bring it in at this stage, because undoubtedly stress plays a part in all of the factors that Tivy's talked about. It is multifactorial. It's not just one thing that causes psoriasis, so we can't, unfortunately, just change that one thing and cure it. But all of these factors play a part. Stress does make a difference, but we don't know whether stress comes before the psoriasis, or the psoriasis actually causes people to feel more stressful. In fact, it's very likely that there is a two-way interaction between feeling stressed because your skin is not what you want it to be, and that just adds more stress. A lot of people mistakenly think that smoking relieves stress. So I know I keep going on about smoking, and probably most of you are not smoking, but there's a lot of myths around the role of smoking as a stress reliever. In fact, it does the opposite. So if you're still smoking and you're feeling stressed, you're actually making your stress worse, as well as probably making your skin worse. And again, I know it's difficult to give up smoking, but seek help on giving up smoking if you can, because it definitely affects stress adversely. Things that you can do in order to reduce your stress are be active. I don't mean going to the gym 3 times a week and really going for it. I mean being more physically active generally, being out and about, doing much more walking, working up to perhaps doing something every day if it's possible, 15-20 minutes of exercise every day, but finding things that you like doing, because if you're more active, then you're switching off the stress response. And if you're doing something that you like, you're overriding the stress response. So find the things that you like doing, whether it's taking your grandchildren down to the park for a kick-around with a ball, whether it's going to a weekly strictly dance class, where, you know, whatever it is, find the things that you like doing and invest your time in the things that you like doing, because it will help relieve your stress and keep you more physically active.
Thank you. Barbara asked, her psoriasis seems to be getting worse as she's getting older and is in her 60s and on methotrexate. Is there anything, you know, more that she could do? Is it usual that psoriasis gets worse as you age, for example? Divy, you're on mute currently.
Sorry. Yeah, so it can go either way. So it can either stay the same, it can get worse, it can get better. It's very difficult to tell what your psoriasis will do for each individual. It's a very individual journey living with psoriasis, as many of you know. And and you're taking methotrexate at the moment. So the question would be, is that dose of methotrexate right for you? And I wouldn't be able to answer this, unfortunately, but is that the right dose for you? Is that the right treatment for you? Do we need to think about a different treatment for you? If you were in my clinic, that's what I would be thinking. And in terms of in terms of what you could do for yourself, I mean, all the things that we've discussed today, that Chris has talked about, stress management, keeping active, and I know you're doing another Facebook Live later this week on exercise and healthy diet as well. So as much as you can for yourself, and then obviously working with your doctor with regards to finding the right dose and the right treatment for you.
And Lisa asked a great question. What about vaping and psoriasis? We hear a lot about giving up smoking, and obviously many people find that vaping is a good in between smoking and not. What are your thoughts with regards to vaping and psoriasis? Chris?
I'll come in first and say it's a brilliant idea. Vaping is better than smoking. There's very little doubt about that. The ideal is not to smoke at all. But many people find it difficult to make that huge move from being a smoker to being a non-smoker. And as Helen said, vaping is a good jumping off point, if you like. But there's no doubt about it that many of the harmful chemicals in smoking are not there in vaping. So you're doing yourself some favors by choosing to vape rather than smoke. But I don't know, Tivi, if you wanted to say a little bit more than that, because you know, the limit of my understanding of the chemical reaction on the skin is quite limited.
From my understanding, yes, it's better than smoking, but I think that it can still have an adverse long-term effect, particularly the nicotine content in it.
Thank you. It's a very, very popular question, and certainly one, you know, that we ask ourselves when researchers are looking at the link between smoking and psoriasis, and, you know, what about vaping now, because it's, you know, a different area.
Helen, can I just very quickly come back on that, just to reassure those people who are asking those questions? The first thing I'd say is it's really good that you are thinking, you're considering whether I should stop smoking. And just a gentle reminder that the average number of times that people attempt to stop smoking before they actually stop smoking is 7. So if this is only your second, third or fourth attempt, either by reducing or trying alternative methods, don't give up, because you know, we know that people struggle with it. Keep going, ask for help, speak to other people, find out what's worked for them, but keep going, because you'll get there.
Okay, thank you. So we'll be drawing to a close in a few minutes. So if there are any burning questions still there, do please drop them into the chat. But as we mentioned at the start, this is Psoriasis Awareness Week, and we've talked quite a lot during this Facebook Live session about positive changes, and so it's our 29th Psoriasis Awareness Week, and so to celebrate that, we're launching our So Active 29. So if you do want to take any small step changes to try and help improve your lifestyle, then you might like to do an Active 29, for example. I think Christy said about, you know, maybe increasing, you know, having a walk a day, or, you know, those sorts of things. It doesn't need to be a marathon. I think there's lots of different ways that that we can improve our health. Thivi kindly mentioned that we do have another Facebook Live on Thursday, and we're delighted to be joined by a physiotherapist and dermatology nurse. So do please join us again on Thursday, who will help come up with some tips that you might need, you know, that gentle persuasion to perhaps start improving your exercise, for example, and what we can do to help in that respect. So, so we've just got a couple more questions before we leave today. And so Elizabeth is asking about her 9-year-old daughter with psoriasis, and is there a link between certain foods and outbreaks, and if there's any foods that should be avoided. Thivi, this possibly could be a crossover, could it, because of the research in eczema and childhood and that kind of different sort of inflammatory skin disease?
Yes, exactly right, Helen. So for children with psoriasis, we don't recommend any dietary exclusions. It's quite different from eczema, where there can be very specific triggers, for example, egg allergy or a dairy allergy, and that you can test for it, and very specifically that applies to eczema. But for psoriasis, no, there doesn't appear to be any dietary links to psoriasis in children. And I wouldn't recommend cutting any food groups out just because she's growing and she needs calcium for her bones, and I wouldn't recommend cutting out dairy for that reason. She needs protein, so I wouldn't cut out eggs and things like that, because she needs that for muscle development. So it's not, we don't have any evidence that cutting certain foods out of a diet will help psoriasis in children.
Thank you. And Leanne is asking about you know, this huge movement amongst people living with psoriasis regarding dietary interventions. And Thivi, when we were chatting just before this live session, you mentioned that the reason why you studied nutrition as well as dermatology was because, you know, of this, that you wanted people to have the right information, because there's quite a lot of confusion around.
Yeah, so I do get patients coming to clinic who've tried a variety of different diets, and the reason they're coming to clinic is some of those extreme diets haven't been very helpful for them. And I think that the people that you're referring to who are suggesting various diets to heal psoriasis, we have to remember, and Chris mentioned this earlier, weight matters with psoriasis as well for some people. So maintaining a healthy weight and a lean weight is important for psoriasis. And several studies have confirmed that if patients' body weight is in the overweight or obese category, that losing weight can be really helpful for their skin and can help the treatments that we use work better as well. And it may be that some of the diets that people are suggesting out there, for example, there are juice cleansers, etc., people are going to be losing weight on those diets. And it wouldn't surprise me then that their skin may happen to improve alongside that. But I would not recommend those diets because they are really quite extreme. And I have had eczema patients particularly who've gone on very strict exclusion diets on their own. Obviously, I haven't recommended that. And they come to see me and they say, oh, my hair's falling out and my skin is really dry. And I'll check and they're iron deficient because they've cut so many foods out of their diet. Or they will have insufficient essential fatty acids, or they've become B12 deficient. So very extreme diets like that can actually lead to nutritional deficiencies. Cutting out dairy without really thinking about why you're doing that. Again, particularly for women growing bones, we need that calcium to prevent against osteoporosis in the long term. So I'm very cautious about these extreme diets, and I don't think that those are necessarily a psoriasis cure. It may be that patients lost weight when they were sticking to these diets, and that helped their psoriasis because we have good evidence that that's helpful. But I don't think you need to comply to one of those diets to see an improvement in your skin. The other thing to mention is that we talked about gluten-free diets before and whether these help. And many of these social media people who recommend certain diets do recommend going gluten-free. And a gluten-free diet can be helpful in psoriasis if you have celiac disease as well, which you can have because they're autoimmune conditions, they're kind of cousins in the same family. Or if you have any celiac antibodies. So you can have the blood test being positive without actually having the full celiac disease. So if you fall into any of those categories, going gluten-free can be really helpful for your skin. But if you're like the vast majority of the population and don't have those and have psoriasis, going gluten-free, studies have shown, is not helpful for your psoriasis.
Yeah, and if I could just say something about that, because I see people who come and they're desperate to make a difference. You know, most people who go to extreme lengths are really, it's a red flag for me as a psychologist, that they're really desperate to make a change. And I think that what I will always say to them is, go to a reliable source for information, because it's easy when people are desperate, when the skin is flaring, the joints are sore, and you know they want something to change. It's easy for them to latch on to, you know, maybe a social media influencer who's saying, this is what I looked like before, this is what I look like now. But those sources are not always reliable. So certainly the Psoriasis Association, check it out with the Psoriasis Association. The reason that we are here, Tivi and I, as professionals, is because we know that the information that's given out through the Psoriasis Association is based on evidence. It's good quality. Speak to your doctor. You know, link in with the Psoriasis Association and rely on the information that they give you, and form alliances within the Psoriasis Association. If somebody else is looking to be more active, to lose weight or to stop smoking, find a buddy within the organization, because it's easier to do, make changes like that with other people. But you know, don't give up. We do know how desperate you can be, and we're here to help. And certainly the Psoriasis Association is your best buddy in these circumstances.
Thank you, Chris. And yes, absolutely, people can get in touch with us directly or get in touch with each other, either via our website, forums, or Facebook group, etc. So just one last question. Obviously, the main focus of this session has been with regards to the role of diet, nutrition and food, but scalp psoriasis does tend to be an area that people find the most difficult to treat. Is there any tips there for Catherine, who's asking, you know, any advice for treating scalp psoriasis?
Yes, you're absolutely right. Scalp psoriasis can be a real challenge to treat. I love the video on YouTube that Guy's and St Thomas's did. And I always direct my patients to have a look at that, because sometimes the doctors can give you the same treatment, but and you can go again and they've given you, you know, another steroid or another salicylic acid treatment for your scalp, and it's not actually the treatment, it's how you're applying it that is really important. And if you watch the video, you can see the correct application of the ointments, how to descale carefully as well, and how to apply your treatments afterwards. And that is a maintenance routine. It's not something you need to do every day. Sometimes we use it every day when you've got a flare up, but it's something that hopefully when your scalp is under control, you could just do it once or twice a week, and that can really help to get your scalp under control. So that's a leave-on treatment to help to descale, a shampoo to wash out with, and then an application. So either something like I use diprosalic or Betovate scalp application. So and then a leave-on product afterwards as well. So it's usually 3 steps to try and really tackle that scalp psoriasis. And the other thing is to try not to pick too much, because you can get that Kerbner phenomenon where the psoriasis comes back more. And I don't know, Chris, if you've got any tips and tricks to help with that urge for picking.
Yeah, it's very difficult. You know, we refer to things like habit reversal, because we know that people will scratch out of habit. The itch response happens and we automatically go to scratch. So interrupting that itch scratch cycle is really important. Keeping your nails very short. If possible, go into bed with gloves on. I know it sounds quite strange, but sometimes, you know, subconsciously at night you're scratching. You're not even aware of it until you see the blood on the sheets, for example. It can be really difficult. Ask for help for it, but interrupting the cycle so that you don't have an automatic response. Some people have words that they will say when it starts to itch. They'll have an opposite word that helps them to not scratch, but to think of something else, distraction, that can work for some people. There's a whole range of things that can help. Again, it's finding a thing that helps, that works for you, because the same thing doesn't work for everybody. But it can be difficult, but ask for help. You know, when you next if you see a dermatologist, ask your dermatologist for help if it's an issue. But certainly the concern around not using medicines as prescribed is one really important for us to talk about, because people will often lose motivation to keep applying the scalp preparations or the skin preparations. We know it's difficult, but it's so important that you continue to use the medicines exactly as they've been prescribed for you. Because even if you let it drop off for a short while, or you know, get into a habit of forgetting to apply things, it can make that difference between that medicine working and not working. So it's difficult. You have to treat it like a project. You have to see that your role in this is to apply the treatments exactly as you've been shown to, and as often as you have been shown to. So if you're not sure, ask the nurse when you go to clinic, or ask the dermatologist to show you again how to do it.
Thank you. And I think that that's a really great way that we might end on. Do you feel then that really treated psoriasis is a combination? It's healthy behaviours plus usual psoriasis treatments, and together they, you know, rather than standalone, can help.
I always say to patients, take the best of everything. Take the best that medicine has got to offer you, all the research that's gone into the treatments that we prescribe you. Take the best of healthy lifestyle. Use it all to your advantage. You don't have to fall into one camp or another. You don't have to fall into the category of, I will only try and treat my psoriasis with diet, or I will only try and treat my psoriasis with medication. Use everything that we know to be helpful to your advantage, whether that's you know, exercising more, or stopping smoking, or the prescribed treatments. Use it all to help you.
Yeah, I absolutely agree. It's a partnership between what you can do to live your healthiest life and what the medical and nursing profession can do to help you with those treatments. And also, you know, don't beat yourself up about struggling to manage. Go and ask for help. If you're really struggling to do something, if your mood is low, your motivation is low, and you know you need to make a change, then ask the people who are helping you to manage your psoriasis for some help with that. It's not separate. It's not something that, you know, you do that they can't help you with. They should be offering help, but if they're not offering help, then go and say, look, I'm really struggling at the moment. I need some support in order to whatever it is you want to change. You're not a bad person because you can't be perfect with managing everything all of the time. It just means you struggle from time to time. And if the clinicians treating you know that, then they can help you to get through those difficult times.
Thank you. Thank you so very much, Thivi and Chris, for joining us for this Facebook Live, our first ever one in this, our 29th Psoriasis Awareness Week. And thank you very much for joining us and for asking those really important questions. I do hope that you have all enjoyed the session.